now for when you introduce.
Wow, you're all set up.
All right, hey, welcome to Radiant Living Center. We're here at Radiant Living Center with Dr. Frank, and he is an expert on vitamin D and the COVID, and he's going to share some information. If you have some questions during the time he is speaking, feel free to write them on the Facebook Live messages there, or if you're on Zoom, feel free to write it in the chat, and we will be able to answer those. And he may have some questions for you too. So thanks for joining us.
Okay, welcome everybody. Are we good?
We're good.
Okay. Well, welcome everybody. What we're going to do is we're going to go over vitamin D and how it's absolutely critical now in COVID-19 cases. When I put this presentation together, it was about 4 months ago. They didn't have all the research hadn't come out like it's come out now. So we're going to add more to it. So what I'm going to do is I'm going to start out with actually they just did some research where they demonstrated that in the hospital in Spain, they took 78 people that came into the hospital with COVID-19, and they put them in two different groups. One is the vitamin D group and one is the non-vitamin D group, and they both received the best medical care they could receive. And the only difference was one group getting the vitamin D. And what they found out was pretty incredible. They found out that in the vitamin D group, which 50 of the 78 were in the vitamin D group, only 2% of the people coming in actually ended up in the ICU, and the rest of them, did okay, and they just, were just checked out, and they all survived. So all 50 that were put on vitamin D survived, and like I said, only 2% or one patient ended up in the ICU room. Now, as expected, the other group, the 28 of the other group, I think three had died, and 50% of those ended up in the ICU. So that's pretty significant and pretty unbelievable, that vitamin D would do that. So I'm starting there because as I'm going through the presentation, I will refer back to that study and kind of when we're talking about lab values and everything. So what I'd like to do is start out with, does anybody know what their lab values are of vitamin D? And if you do, if you could just put them in the chat room so I can kind of see your numbers coming through if anybody knows what they are. So just put them in there, and as we go along, I'll get an idea of what your numbers are, and we can talk about it when we get to the numbers. Okay, so we're this vitamin D epidemic, because there's just a ton of people. I think 42% of people in the U.S. have critically low values of vitamin D, and we'll find out why as we go along. So I'm just going to do an overview of what we're going to talk about. We're going to talk about vitamin D increasing the survival rate of not only COVID-19, but also viral infections, bacterial infections specifically. Will vitamin D help with acute respiratory distress syndrome? That's actually what takes you out in the hospital, is the acute respiratory distress syndrome. And we're going to talk about exactly what that is and how vitamin D protects you from going into that critical state. How does vitamin D work? We're going to go over exactly how it works, and I realize there's some medical, I guess there's some nurses out there, hopefully. I'm actually an ex-nurse, so I used to work surgery and post-surgery orthopedics, so shout out to all the nurses out there, but we're going to keep it kind of basic. Okay, what blood levels are necessary? So when you get a blood level, what does that mean? And how does that relate to gene expression? Because gene expression is actually how vitamin D saves you. So we're going to talk about exactly what that is. And then how much do I take to get the benefits of vitamin D that I'm going to talk about? How much do you need to take? And when does vitamin D not work? We're going to talk about lots of nutrients. If you don't have certain nutrients on board, or if you're taking certain drugs, then vitamin D is not going to work. So you can take all the vitamin D in the world, and it's not going to do you any good if these other conditions are present. Okay, well, what I want to start out with is, kind of what we learn in school, because I learned this in school and I sort of forgot about it, because it was so basic, and so I want to go over what we learn in school. Well, first of all, vitamin D comes in either as fortification or the sun hits your skin and makes vitamin D. Both of those will come in and travel to the liver, and then it gets changed to this 25-OH, and that's the inactive as well. So vitamin D is relatively inactive as it comes in, and then it gets changed to this 25-OH, and that's not really active. But then when it goes to this, it's changed in the kidney to 125-OH, or calcitriol. So this is calcidiol, adding a molecule on there, and then it goes to calcitriol 3, just think of 3. And when it's activated, it allows calcium to come into the body through the intestines, and that calcium goes over the bones, and it packs the calcium in there so that the bones don't become soft and bow. That's what rickets was, when the bones would bow, and that's basically rickets. So I learned that in I think nursing school and chiropractic school, and then that was about it. And then I thought I knew everything about vitamin D at that point. So our story really starts with understanding the background on why didn't we study light therapy more. And so I want to cover the background of why we were just derailed from studying vitamin D, and only studied it in the last 10 years or so. Well, helio light therapy came about 400 BC by Hippocrates, who actually the Hippocratic oath that all the medical doctors take was back when they were studying light therapy, and he coined it heliotherapy. And then that went forward into today, or just in the 1800s, 19th century, became very popular for tuberculosis, lupus, infections, immunology, heart conditions, all sorts of things that they studied and used light therapy for. And then we sort of lost track of it, and we'll talk about why we lost track of it. But by the 1933, there were over 165 diseases that sunlight provided benefit for, like infectious diseases, lowered blood pressure, blood sugar lowered, and asthma, arteriosclerosis, all rheumatoid arthritis, and then so why did we lose track of all this? Well, the growing power of the pharmaceuticals, and then light therapy fell into disuse. Why use light for tuberculosis if you can give a drug? So that kind of makes sense from their perspective. 1960s, the miracle drugs hit the stage, and everybody sort of forgot about the sun. By the 1980s, everybody was scared of sunbathing, so they stayed out of the sun, and they put on sunscreen, which blocked all vitamin D. So really, we ran in the opposite direction. So vitamin D makes a comeback, actually. So what causes vitamin D to become so interesting? Well, increasing cost of antibiotics. Well, there was drug-resistant antibiotics, and so then these multiple drug-resistant antibiotics, or drug-resistant, and then extreme drug-resistant TB. So then now what happens is, well, the antibiotics worked at first, but then they're not working, so they need a next solution. So they have to go back in time to study vitamin D. But if you look at this, so 1945, there was virtually no interest in vitamin D until 2005, and then all of a sudden it skyrockets. So what creates that skyrocket effect? Well, here's what created it. Vitamin D actually regulates up to 5% of your human genome. So your genes are what control, basically your control switch in your body is your genes. And so if you can control 5% of that, that's pretty unbelievable. So there's this big interest in vitamin D all of a sudden. And also tied together with that, you have receptors in your body, all these organs, small intestines, immune system, lungs, thymus, spleen, heart, the brain. So if you have all these organs that are pulling vitamin D in so that you can change gene expression, that's pretty incredible. So they thought it must do something. You wouldn't regulate something so highly controlled if it wasn't important. So they thought, oh, maybe vitamin D is important. So I'm going to briefly go over the new mode of vitamin D. So the UVB light comes into the skin, hits the skin, and is changed into cholecalciferol or vitamin D, and then that goes to the liver. Again, it's changed to the 25-OH. Then it goes to the kidney. That's changed to the 125. So mainly remember the 125-OH, vitamin D. That's the active, okay? Then, now what's really incredible is it comes in here to the cell, each cell where it has a vitamin D receptor and can pull it in, and it attaches to the vitamin D receptor, but it needs vitamin A to do that. Okay, we're going to find out why that's super important. So vitamin A and vitamin D are sort of tied hand in hand. So if you don't have any vitamin D, vitamin A, vitamin D is not going to be active. If you don't have any vitamin A, vitamin D is not going to be active. So you need them in synergy. So then they come on here and then they attach to your DNA in the nucleus, and then they start transcribing for proteins to make you healthy. So that's what we're going to be looking at, is what do they do once they start transcribing for different sequences. Okay, so now you have, well, before I go on, I want to say that vitamin D has so many different beneficial effects that we're not even going to get into. I mean, from increasing your REM sleep. So I give a patient, vitamin D, and they say, oh, I sleep a lot better. Well, it helps you go into REM sleep. So a lot of things that are not related to what we're going to talk about today, but I just want you to see when you hear somebody talk about vitamin D in heart disease or vitamin D in Alzheimer's, that it's the same mechanism. So vitamin D in the brain, it's going to come in the brain, vitamin D receptor and vitamin A match together, and then you produce all these beneficial effects for the brain, like increasing your energy, increasing serotonin, helping you sleep. So the same mechanism is involved, no matter where you are in the body. Same thing, Alzheimer's. The vitamin D comes in, it comes through the cell, goes to the nucleus, transcribes DNA, and then there's vitamin A, vitamin D come together, and then you have all these beneficial things to regulate 1,000 gene regulation. Now we know more genes are affected. So basically, vitamin D regulates almost everything in the body in some way. So then I'm going to do one last before we get to what we're going to talk about today, but I just want you to get the idea. So vitamin D comes into the heart, say, and again, the 125 comes in, turns on the DNA, and it encodes for all these beneficial effects that help keep your heart healthy. So again, disease condition, so it either prevents or improves all of these different things related to the cardiovascular system. And we don't have any time to get in this. I just want to give you the idea that this is not just for the lungs is what we're going to talk about today. Improves vascular tone, anti-inflammatory, hypertension, epithelial function, lipid lowering effect, all of these effects that are related to the beneficial effects of vitamin D. Same mechanism we're going to talk about for the lungs. It helps the heart as well. Okay, now one thing I'm going to get that's, this is kind of technical, but the mitochondria, it's part of your cell that produces 90% of your energy. So if your mitochondria is having a problem with your mitochondria, then you're not going to produce very much energy. So again, vitamin D in the big picture affects your mitochondria. So this is your energy producing. So that's why you have tremendous effects from vitamin D. It affects your mitochondria. This is anti-aging from vitamin D because of its effect on the mitochondria. So you're producing more energy. You age better. That's the idea there. So I won't get into that, but basically you age better. Now, longevity is a side effect of adequate vitamin D levels. Why? Look what they did over here. When as your vitamin D levels go up, so 30, 40, 50, 60, 70, and nobody's tied in their vitamin D levels. So, oh, am I?
They can't hear you on there.
Oh, okay.
I mean, they can, but
Can you hear me better? Is that better?
let's see.
Okay, here, I'll just put the mic in front of my nose here. Okay,
Yeah, it's connected.
maybe I'm not.
Well, let me split it so.
Hello? Can you hear me a little better?
There's a little bit of a delay.
A delay, okay.
Yeah, so we'll give them just a second.
Okay, well,
Sorry.
okay, I'll hold this in front of my mouth. That might
probably
make,
helps.
Okay, good deal. Okay, so longevity is related to vitamin D levels. So, 30 to 40, this is where your longevity goes up significantly. Now look, as you go down to 20, 10, 9, your all-cause mortality goes way down, say, as your vitamin D levels drop. So if you want to live a long, healthy life, get plenty of vitamin D, is what that basically says. Now, we talked about turning on your genes and having better gene expression. Well, some of my patients, when I'd say, okay, you have better gene expression when you take vitamin D, and some of my patients would look at me and say, well, wait a minute, I have lupus, or I have RA, and I don't want to boost my immune system, so I don't want to take vitamin D. So I thought I'd point this out so that to make it really understandable is this is when you take vitamin D, some genes are turned on and some genes are turned off, and I'll show you why this is very important. So this is some research where they before they gave vitamin D, these genes were turned on, and then off, and then it turns these genes on for better health. And then down here, these genes were turned on, and it actually shut them off. And we'll find out why this is real important. We'll talk about the cytokine storm, where you're overshooting your immune system, so you want to turn certain genes off while at the same time turning genes on. So again, when you take vitamin D, it doesn't automatically turn them on or turn them off, but it allows the body to then regulate when they need to turn on, when they need to turn off. So that's very important point. So vitamin D's effect on the lungs. So I'm going to specifically talk about vitamin D in the lungs because of, when COVID-19 first came out there, they thought it was a lung disease. And now we know it has to do with the cytokine storm and blood clotting and other things like that, where the immune system is overshooting. Because the virus itself doesn't do anything to you. It's your reaction to the virus is what gets you. And so vitamin D is key to keeping your immune system from going out of control and causing blood clots and all those things. And so we're going to talk about specifically for the lungs. So ability to fight disease. So even if we don't talk about COVID, if we just talk about regular diseases, it helps you with that. Prevent disease and normal lung development. And this is going to be very important. Okay. So this is my favorite slide. It shows on the top what happens to your immune system with no vitamin D on board, and on the bottom down here having vitamin D on board. So the difference between the two, having vitamin D and not having vitamin D. So I'm going to start out with no vitamin D first. For rhinovirus, RSV, and influenza, just different types of viruses you might get, because the immune system fights viruses differently. Each virus is not fought the same. So without vitamin D, you have to ramp up these interleukins to fight the virus. You have to ramp up different interleukins for RSV, and even different for influenza. So without vitamin D, you can still mount an attack on a virus without having vitamin D levels adequate. But down here, when you give vitamin D, you actually ramp up interleukins and other viral assisters that help your body fight off infections. So you actually decrease viral replication a lot more effectively with vitamin D. This is all you need to know. You decrease I can't even read my own slide. Decrease epithelial cell death. Basically, you help your body fight the viruses more effectively with vitamin D here. But more importantly, do you see how you downregulate in red? See how it's all in red? Like interleukin 6, that's like kicks in, that's an overreaction and more of an inflammation reaction to the virus. And when you have vitamin D levels on, you actually decrease the cytokine storm that everybody's going to be talking about. So you downregulate all these interleukins and so that you don't overshoot, and basically your own immune system is what takes you out. So this is the critical part right here. So you fight it better, and let's see. Can everybody see that on there? Or something popped up on my.
Oh, no.
No, okay. Okay, I'll click out of it. Okay, so you fight any infection better with vitamin D, and specifically to COVID-19. Now, since I put this presentation together, they've shown a lot on vitamin D and decreasing blood clots that are part of COVID-19. So that's part of it as well. So anywhere your immune system is overshooting, then you can get blood clots, inflammation, and that's kind of what takes you out. So here we're going to go forward, and I want to talk a little bit about the lungs. Now, if you don't have a physiological background, I want to go over this a little more detail so that it makes sense when we go over it. So in the lung, we have these little sacs in the lung, and those sacs fill up with air, and then you have gas exchange. Well, obviously, if you have pneumonia or fluid is getting in those sacs, fluid in the lung, pneumonia and inflammation is basically what that is. You can't breathe there. So I'm going to blow these little sacs called alveoli up so that you can see them. So here's the sac, okay, that's filled up with, on the left side, or my left side, in this area, that's where the air is. So you breathe and you bring it down into the lungs, and over on the left you have this open sac, and the air comes in, so the oxygen goes into the blood, and then the CO2 goes out, and then you have gas exchange. Okay, so you have ventilation bringing the air down, then you have gas exchange. That's what it normally functions. Now, normally you produce something called surfactant, which coats this balloon, we're going to call it, and keeps it open so it doesn't collapse. So that's normally what happens. Now, when you get any viral infection or any kind of pneumonia, what happens is this fills up with fluid. So if it's filled with fluid, you can breathe all you want to, but you're not going to have gas exchange because you can't get the oxygen down here to the blood. Plus, when you have an infection, you have all these this fluid leaking into this area, and then you're killing all these white blood cells, and you cause all these debris to be produced. So life-threatening ARDS, acute respiratory distress syndrome. So if you bring fluid down here and you can't have gas exchange, that's a bad situation. Then if these sacs collapse, you have to, you've heard of people getting put on a ventilator. Well, that's why they ventilate you, is because they want to open up these airways. And remember how when COVID first came out, they put people on ventilators and they would not help. And these doctors were saying, hey, it's not helping because opening these sacs up didn't help this situation where people were clotting, see. So also with this, if you're fighting an infection, you might become septic, which basically means that you're producing a lot of toxins when you're fighting these viruses and bacteria. That can create you to a condition called sepsis, where it's a life-threatening situation, because when you're septic, your blood fills with these toxins, and if enough toxins get in here, then the blood vessels can dilate, and then you can't get blood pressure, so you go into septic shock, and you can die. So you want to be in the hospital if you go into septic shock. And systemic inflammatory response syndrome, that's where you get inflamed, and that's when you feel achy, you feel weak, you feel all sorts of things like that, because you're becoming inflammation all over the body, so you ache everywhere. So that's hopefully, sorry I went so fast through this, but I just wanted you to understand the basics of how vitamin D, by fighting the infection better and not getting the inflammation and fighting this off yourself with vitamin D, you're going to save yourself. So lung viruses, randomized trials, vitamin D supplementation, preventative effect for upper respiratory tract infection. Now the upper respiratory tract is your nose, your nasal cavity, so that's upper tract. So I highly recommend taking vitamin D to avoid upper respiratory tract infections. Then the next research, vitamin D supplementation was safe, protected against acute respiratory tract infections overall. So whether it's upper respiratory, lower respiratory, you're protected by taking vitamin D. Now look specifically, increased use of antimicrobials. Well, if you have low vitamin D, doesn't it make sense you're going to need more antibiotics? Why? Because you have, usually you get a respiratory viral infection, and that doesn't bother you too much. But then you get a secondary lung infection, because people don't clean out their nose with a neti pot or something like that. I get all that garbage out of my nose, so I never, get a lung infection because I get all that stuff out of my nose. But if you don't, you draw all that bacteria down into your lung, then you get a secondary lung infection. So increased risk of a respiratory infection with low vitamin D levels, because if you can't fight this yourself, then it's going to get pulled down into your lungs, and then you're going to get a secondary lung infection. Then you're going to need a bunch of antibiotics. Now this is interesting. Vitamin D deficiency prior to hospitalization is associated with development of acute respiratory failure. Oops. Vitamin D deficiency patients who develop acute respiratory failure have heightened mortality. So yeah, if your vitamin D levels are lower going to the hospital, you have less of a chance of survival, even if they give you vitamin D in the hospital, which I think is amazing that they were able to give vitamin D in the hospital to these COVID patients and basically save their life. So that's pretty amazing in itself, I think. But the point is, take your vitamin D before you go to the hospital. That's my point. Okay, decreased hospital length of stay by taking vitamin D in the hospital. So I highly suggest that if you're a nurse out there, please interest your staff in giving vitamin D to your patients that come in with COVID-19. Less length of stay. Vitamin D deficiency is common in people who develop ARDS, acute respiratory distress syndrome. So yeah, if you develop ARDS and you need to be put on a ventilator to give you positive pressure and open up these alveoli, these balloons, yes, definitely. If you're if you're vitamin D deficient, sorry, I'm talking so fast that
Water deficient.
I know I'm water deficient. I'm H2O deficient. Okay. So vitamin deficiency is common in people who develop ARDS. And you can see that because if you can't fight your own infection adequately and you're in the hospital, you have more of a chance of needing a ventilator if you don't have vitamin D on board. So again, ARDS, sepsis, septic shock, systemic inflammation, all of this, you have a less of a chance of survival if your vitamin D levels are not up. So I highly recommend taking vitamin D for any infection, lung or otherwise. Correlation between vitamin D and sepsis. Consumption of vitamin D supplements might be helpful in decreasing the prevalence of infection, sepsis, and mortality, especially in the older aged. Okay, which is what we have. I think the mean age of death for COVID-19 is 78. I think it's 78. Actually 50 or under, they're finding that only 4% of the people dying are 50 or under. 54 or under, 7%. So I just turned 50. That's why I have this number in my head. So if you're wondering, what's the chances, that something's going to take me out here. So okay. So now this came out. Now I put this out 4 months ago, and I'll give you a link to this YouTube channel, and you can send this out to your friends and family if you want them to survive. Now, if you don't like your family or your friends, don't send them this video. No. Okay, so this came out in April 2020. Vitamin D supplements could possibly improve outcomes. Now watch this. Mild, ordinary, severe, or critical response to the virus. So if you're mild, you only had just, mild symptoms. Ordinary, you had pneumonia, chest CT scan, yes, you definitely had pneumonia. Severe, you were hypoxic, you had low oxygen levels, so you needed to be on oxygen and this and that. Critical, they might have put you on a ventilator or whatever. Now watch this. I found this amazing. If you had mild symptoms, and I'm sorry you can't see this, I'll have to blow this up, but mild symptoms at 31 nanograms per deciliter. So and this, I consider this low. We're going to see I consider this low, 31. 27 you had ordinary, ordinary, and then severe 21. So as your vitamin D levels go down, your severity goes up. So this was the hint. When I read this, I thought, I can put a video out there 4 months ago, and I was pretty sure that vitamin D was going to save everybody. Now, there weren't a whole lot of us out there promoting this, but now we've got a lot more backing. But this is back 4 months ago, before we knew what we know that, I shared with you earlier. So now, vitamin D is really a pro-survival molecule. It turns on your DNA and helps you survive, not only with everything. I mean, get your vitamin D levels up. If anything I convince you of today, get your vitamin D levels up. Okay, now I want to show asthma on here because, lungs, everybody, you have a lot of people have asthma. So I'm going to go over asthma with this. So basically, vitamin D supplementation reduced the rate of asthma exacerbation. The same mechanism. Here's the lungs down here. There's the fluid, the sacs, the alveoli. You're pulling air down into these so you can have gas exchange. Now, what if you have smooth muscle in here clamping down and you can't get the air from here to here? You might die. So watch, inflammation. Vitamin D knocks down inflammation, so that's why it helps in asthma. So if you understand the mechanism, it makes it easy to understand why it helps you. Now what I want to show you here is very important. Vitamin D helps in fetal growth and development. So, and by the way, most prenatals are so deficient in vitamin D, it's not even funny. So, when you're growing a person inside of you, well, not inside of me, but inside of you maybe, when you want to have good lung development, good fetal programming, so that by the time you get to here, you're a full-grown teenager, and then you have asthma. Trying to give vitamin D here is not very smart. It may work, but it's not very smart. You want to give vitamin D here and have normal lung development. See, because if you get here and you didn't have normal lung development and you give vitamin D and say, oh, well, it didn't help with my asthma, well, maybe you should have started here, not here. That's my point with asthma. Okay. Now, this is a great website. I'm going to promote this. I don't even know these people, but Grassroots Health, I highly recommend their site because I think you can get on there and get your blood labs drawn for like $65. So, and great website where you can, lot of information that I even use in my presentation, but this goes over vitamin D deficiency. Rickets is only the tip of the iceberg. All of this down here is why you want to do that. And you can read, I'm pressed for time, so I'm not going to go over all this. But basically, you want to take at least 6,400 international units a day if you're pregnant or getting pregnant. That's a minimum from this lady's research. She did a phenomenal job, and I highly recommend go to the site and go into this information. But yes, as a pregnant female, you want to get at least that much so that you have enough spilling over into the fetus. Okay. When will vitamin D not work? Well, this is my favorite part. Again, vitamin D comes in and it needs vitamin A, retinoid receptor, vitamin A. So it's no wonder that vitamin A can cause cancer. A lack of vitamin A can cause cancer, and a lack of vitamin D can cause cancer. Well, what if you're doing a research experiment and you're giving them vitamin D, but you're not giving them vitamin A, and then you say, oh, well, vitamin D didn't help cancer because we gave vitamin D and it didn't help. Well, wait a minute. What if all your people in the study were vitamin A deficient? See, that's why you need to know your physiology before you put these big high dollar. They can hire me to come in there. No, they're not going to hire me to come in there. But basically, you need to know what you're doing when you're setting up these experiments. Oh, here's another one. Magnesium, absolutely critical in like 600 enzyme steps in the body. Magnesium is one of the biggest things that we're deficient in. Oh, by the way, don't use magnesium oxalate, or it won't do you. It's only 4% absorbable. So magnesium. See, if you go from vitamin D to the precursor to the 25-OH to the 125-OH, guess what you need to make those conversions? Magnesium. So you can take all the vitamin D in the world and it will never reach the active form if you don't have magnesium. And probably a good portion of us are real low in magnesium. Chlorophyll is a great place to get magnesium. That's why it's green, because it's just like the hemoglobin, except it's got magnesium as its center. So that's why chlorophyll is very good for you, because that's how you get the best magnesium. Okay. Now, I have people, they'll say, well, doc, should I use zinc? Should I use vitamin D? Should I use this? Well, I want to point out that you need everything. If you're trying to build a car and you only have engines, you're not going to build very good cars. So if you look here, each one of these different white blood cells use a different set of nutrients to work at optimal function. So this one needs vitamin D, vitamin E. This one needs zinc, N3 fatty acids, essential fatty acids. So each one needs a different set of nutrients. So when somebody says, well, which nutrient do I need? My opinion is you need them all. And if you're doing these studies on patients and they don't have all their nutrients, how are you going to, have an effective study? Okay. So drugs that interfere with vitamin D. Well, you've got a whole list of them, but I just want to, briefly go over them. There's drugs that interfere with vitamin D absorption. Vitamin D is a fat-soluble vitamin, so it has to come in with fats. So if you're taking and believe it or not, people take this stuff, I can't believe it, but they take fat inhibitors to lose weight. Well, they're not fat deficient, they're carbohydrate excess, and they're taking all these fats. So then they create more problems for themselves, especially if they don't absorb vitamin D. That's crazy. Drugs that interfere with vitamin D metabolism. So you have statins, antidepressants, corticosteroids. All of these things break down vitamin D or destroy it. So how are you going to get your vitamin D levels up if you're taking like H2 receptor block or acid blockers, all this stuff? So here's an example. Like if we're going to take a statin, let's take a statin. These are really good for you. Well, actually, they're probably not. But statins, they block making cholesterol down here, but they block it way up here. So they block it here. Now, all of these are beneficial. Now, you wonder why people lose their memory, they lose they get muscle pain and all this stuff, because they are blocking all of these steps. You get down to cholesterol. From cholesterol, you make vitamin D. You make your sex hormones. You make your bile salts. You're stopping all of these processes, so no wonder you have all these side effects. So that's basically why if you're taking a statin, it might interfere with vitamin D levels. Okay, now I want to throw this out there because, we all read research. Well, maybe you aren't crazy like me, but this research comes along and I read this and I say, oh, I'm going to just trust that the research coming out is valid. And you read this and you say, high doses of vitamin D did not provide any advantage over the placebo with respect to non-fatal outcomes in the critical ill in the vitamin D deficient patients. And you think, oh, okay, well, vitamin D is not going to help in the ICU. But then you read and you say eligible patients received a single dose of 500,000 IUs of vitamin D. Well, that's like saying I'm going to give you 1,000% oxygen for 1 second and wonder why you didn't survive. So you have to understand how to read these research articles before you go diving into this the area of research. Another, vitamin D supplements didn't reduce the incidence of influenza. So you're like, well, wait a minute, Dr. Paul, you just told me that it helps influenza. Now here's a research that says it's not helpful. Well, they're only given 2,000 international units a day. that is not anywhere near what you need, which I'm going to show you what you need here in a minute. To have DNA expression, you need 10,000 IUs. That's what you get from the sun. So they're giving an inferior dose, no wonder. And did they check their vitamin A levels or their magnesium? So a study is only as good as its design. Okay. What is the dose of vitamin E? So that's probably what you're wondering around. Is, hey, Dr. Paul, well, how much of this stuff do I take? Well, it's not as simple, or I'm going to make it really confusing. Okay. Well, I'm not going to make it confusing. It just is confusing. Now, your doctor tells you, oh, your lab values are fine, so you don't need to worry about vitamin D. Well, I'm going to give you this extra information because you need to be smarter than your doctor if you're going to survive. So here we go. Now, I hope you can see this slide, and I know it's really confusing, but we're going to break it down and make it really easy. So up here on the top, this is just the vitamin D level. So here's 0 to about 30, 30 or 0 to 30, 30 to 40, and 40 to 60. That's normally where they want you, is 40 to 60 now. And the old way of looking at it was up to 30. So here's what we're going to look at. Why is everybody telling you something? Like, I'm going to tell you something different than maybe your doctor tells you, and I'm going to give you the background behind it so you'll understand why I'm telling you one thing when your doctor might be telling you a different thing. Now, early on, they looked at 30 as the lab value that's normal. So 20 would be inefficient. And why they did that is because at 20, you prevent rickets. And they thought, well, if I'm preventing rickets, then I've got all the benefits from vitamin D, and I don't need any more than that. So why give you any more? If I can prevent rickets, why would I need any more? So that's where it stayed for like 75 years, is as long as you're below 30, because from 20 to 30, they can still show microscopic damage to the bones. So that's why it goes up to 30. So most people thinking vitamin D levels, they're going to think, oh, up to 30, you're good. Well, I'm going to show you, you might want to be 40 to 60, because all this cancer research, you need to have vitamin D levels between 40 and 60 to avoid cancer. So how many, raise your hand out there, how many you want to avoid cancer or just avoid rickets? Well, most of you are probably going to say, oh, I want to avoid breast cancer, prostate cancer, colon cancer. So I'm going to suggest you need to be between 40 and 60 for that. Now, if you're trying to fight off an infection, you might need to be above 60 to fight off an infection, and I'll show you why here in a minute. So that just gives you a reference range. Okay. Vitamin D supplementation could prevent and treat influenza, coronavirus, and pneumonia. Now this came out in, I think, April of 2020. So this is a long time ago if you're talking, coronavirus, but they said 10,000 IUs of vitamin D for weeks, and then followed by 5,000. Why? Because they're trying to get your blood lab values above 40 to 60 nanograms per milliliter. And we're going to, I'm going to talk about why this makes sense here in a minute. So if you guys are totally confused, just hang on for a few more minutes, and I'm going to really confuse you. No, we're going to try to make it a little more understandable. Okay, so you want to be above 40 to 60. Why is that? Okay, now what I want to explain to you is something that maybe your doctor doesn't even know, so you're going to be smarter than your doctor here in a few minutes. Now, vitamin D is what you might take, it'll say vitamin D on the bottle. So you take that vitamin D D3. Hopefully you're all taking D3 and not D2. But the vitamin D3, or cholecalciferol, comes into the body and it gets in the blood. Okay? Now, it is converted to the 25-OH. Now, that's inactive, but that's what your doctor measures. And you might say, well, why is my doctor measuring my inactive if it's not doing me any good? You know, because you could have all the 25-OH in the world and you're not having gene expression. So why would they do that? Well, there's some pretty good reason why they measure it. I'm not going to get into it because it's really confusing and I just want to keep it real simple. But we're measuring the inactive. Now, that inactive is bound to proteins and it runs around in your blood and it's not even available to your cells. 85% of it is bound to proteins. 15%, vitamin D proteins, and 15% is just bound to other proteins. So only 0.3% of what you're measuring is free to go into the cell. So how do you know when you measure a blood lab value of 40 or 60 or whatever, how do you know that that is going in and expressing DNA? Well, let me break it to you. You don't. Okay. So, because some of it could be going to fat storage. Some of it is in your blood. And you're measuring that. And your doctor tells you you're at 30. So, you're perfect. So, you don't have anything to worry about. Well, that's kind of true and kind of not true. What you want is you want this freely active, because none of this, the bound to protein, none of that can get into your cells. But you want this 0.3% to get into your cell, turn on your DNA. Sorry if I'm screaming at you. I get all excited. And so you want it to go into this active 125, because in your white blood cells, it changes it to the active, and then you have DNA expression. So when you're measuring this, you could be not having hardly any DNA expression, and it not helping you. So how do you know if it's helping you? Well, I'm glad you asked. That was a very good question. I'm glad you all asked that. Okay, so watch this. Say you're going to take a dose. Okay, so you start here. Now, 600 international units. Now, if you look up from your doctor and your doctor says, how much should I take? The doctor will probably tell you 600 international units. That's what everything's fortified with. And they think, oh, that's great. You're taking 600 IUs. You're pregnant. You're perfect. Okay, say you were at 17.1. Then that brings you up to 24. And your doctor tells you, you are phenomenal. You are right where you need to be. But now that we have the ability to see what genes are being expressed, that changes the name of the game. By the way, this Dr. Hollick is a genius. He's looking at gene expression, not blood lab values. So at 162 genes expressed, and you might say, oh, great. But watch this. If you take 4,000 IUs, if you're at 22, then it bumps you up to 40, and you say, oh, wunderbar, I'm at 320 genes expressed. But watch this. The sun, you produce between 10,000 and 20,000 IUs. So you go from 17 up to 78 nanograms per deciliter. Look, 1,289 genes expressed. Now let me ask you a question. If you're fighting the virus, the coronavirus, do you want to express 162 genes and prevent rickets? Or do you want to be up here surviving and express 1,289 genes? Where do you want to be? You want to express all your genes, not just the... And by the way, remember that experiment that I told you in the beginning that saved all those people in the hospital? You know what they gave those patients? Let me back up on they actually gave those patients the 25-OH, not the vitamin D, but they gave them 25-OH. And guess how much they gave them when they first got to the hospital? 20,000 international units. And then they bumped them down to 10,000 international units. Why did they do that? Because they wanted to make sure they turned on these genes. See? Now, what if they'd have given them 600, which is recommended by our government? 600, none of those people would have survived, and they would have blamed vitamin D on it. So do you see how it's all in how you set up the experiment as whether you're going to survive or not? Okay. So, it's not what your blood values are, it's whether you're having gene expression. And the follow-up to this study was this study. They actually gave different people the same dose of vitamin D, and they found a varying response to DNA expression. So I may have my blood values at 40 nanograms per deciliter, and I have perfect genetic expression. And you may have yours at 40, and you not have so much gene expression. So you need to be up into the 60 range. So that's why I take 10,000 IUs. I'm no dummy. I take 10,000 IUs and get my blood level. Now my mom, I have her on 15,000 IUs a day because she wasn't sleeping very good. I bumped her up to 15,000 because she's 80. She's probably not absorbing as much. So she noticed when I had her on 10,000, she wasn't sleeping. But I kicked her up to 15, 20,000. She slept like a baby all night. So sometimes you have to experiment with this dosage. You can't just go off blood lab values. Okay. So now I want to get to sun exposure, diet, or supplement. How are we doing on time? Are we doing
all the time you need.
Okay.
We're good.
Okay. Well, if anybody's asleep, this is time to wake up because this is more interesting. Okay. Can I get all my benefits from the sun or from supplementation? No. Here's why. Non-vitamin D benefits of the sun. The vitamin D comes in and creates other benefits that are not related to vitamin D. It increases your nitric oxide in the blood. And how many of you raise your hand so I can see it? Yeah, right. But how many have heard all that research on beets increasing nitric oxide and helping performance of? Okay, well, the same thing here. You get sun, it does the same thing that the beets do, dilates your blood vessels, and it helps you. Okay? Or say you get a bruise. It helps to break down the hemoglobin and get rid of it by getting out in the sun, you see. Or it goes in your eyes, goes to the thalamus, and it helps you decrease your appetite. See, so there's a lot of non-vitamin D, so get out in the sun. And you know what the great thing about Oklahoma is? Well, I'll get there. The great state of Oklahoma. I'm sorry, I'm jumping ahead. Watch this. How many of you use infrared saunas? Raise your hand high. Well, I can't see anyway. So infrared saunas give you this far infrared, which heats up and heals. I mean, that's why a lot of doctors have lasers in their office because it heals the skin, it heals the body. So this is the part of the sun that you're getting these infrared beneficial effects of the sun that you can't get from vitamin D supplementation. I don't have time to get into that, but we could do a whole thing on sauna if you want to. Okay. Now, watch this. So in the summer, you have low vitamin D levels. Or I'm sorry, you have your vitamin D deficiencies are more in the winter because you're just a lot less. So you might say, well, I live in New York. Now, by the way, they looked at New York and Seattle. Later on, they said, oh, there are more deaths in Seattle and New York. Why? Because you can go out butt naked in the sun in Seattle during certain times of the year, and you're not going to make any vitamin D. See? So that's why these people are more prone to dying than way down here in the Sun Belt. That's why, we live in Oklahoma, so we're making sun all year round, see? So that's why you want to live in Oklahoma, move down here and enjoy the sun with us. So the UV comes in. UVB is what you want. You don't produce UVB if you're above this line in the winter. Okay, so how do you tell if you're making vitamin D? Well, here's the quick and dirty. If the sun is at a 45 degree to the earth, then you're making vitamin D. Well, how can you tell that? Well, if your shadow is longer than you are tall, because if the sun's down here, can they see my cursor on here?
No.
Oh, so I've been wiggling my cursor.
They can on there.
Oh, okay. Well,
Not there.
Okay. Well, I've been.
Some of them can.
Oh, okay. Some of you guys can tell what I'm saying. Some of you can't. But if the sun is up here and it strikes my head, and my shadow is as long as I am tall, then you're making vitamin D no matter where you live. So that's the quick and dirty of figuring out whether you're making vitamin D. Is your shadow, and I did this, I laid down my driveway and I marked where my shadow was, and then I knew I was making vitamin D. So don't do it in the middle of a busy street. I don't recommend doing that. Okay, so that's how you find out whether you're making vitamin D. Now, so it's generally between 10 o'clock and 3 o'clock. Now you might say, well, just any time in there. Well, here's the deal. Let's see. If you are out between about 10 and 11:30, that's when you get the most UVB, but not the UVA that damages your skin. So go out and get your, sunbathing done between about 10:30 and 11:30, Oklahoma's time. And that's when you're going to get the highest quality of sun. Don't go, have you ever gone out in 3 or 4 and you feel hot and you're like, oh my gosh, it's just burning me, because the UVA is coming in. That's the deep penetrating that burns your body, or that really heats you up, and you don't have as much vitamin B. UVB. So get out early in this spectrum. Now, remember how they always came out and they said, oh my gosh, people that were more obese were having a higher incidence of COVID-19, or darker skinned people were succumbing to the disease. Well, if you know why, because darker skinned people need 3 times the amount of time in the sun to get the same amount of vitamin D. Wow. Or if you're obese, now why would it be obese? Yes, you're absolutely right. Because if you're obese, a lot more of your vitamin D is going to your stores than is going to affect your DNA expression. So if you're obese, you might need to up it to 20,000 IUs. You see what I mean? So you can't just go on one size fits all. So if you're sunbathing, you can get 4,000 IUs in a skimpy bathing suit, 20 minutes. So 10 minutes on the front, 10 minutes on the back, you'll get 4,000. So that's why I do about 30 minutes on the front, 30 minutes on the back, and I'm done. Okay. Now, watch this on, everybody goes out and they lather up with sunscreen. So you lather up, and most sunscreens block UVB. That's what burns you. But it doesn't block UVA. So you're out there, you're getting wrinkled, you're getting aging, you're getting all that. But you're blocking what you need to survive. Because actually, when you get the UVB, vitamin D undoes this damage that UVA does. So there you're lathering up with all this UVB block to stop the burning, but you're getting all this UVA, which wrinkles your skin and causes a lot of the cancers. So my recommendation is go out there naked with no sunscreen, and then if you're going to stay out there long enough, if you need to stay out there longer, get a zinc oxide sunscreen so it blocks all the UV after that. See what I mean? So this is not the stuff they teach you in kindergarten, boys and girls. Okay, so now there's, look at cancer rates. Now, I don't have time to go into cancer, but look at this. The more sun you get, the less cancers you get. Isn't that cool? Wow. That's interesting. I don't have time to go into cancers, but I just thought I'd throw that out there. So now, look at these people that are the primates and humans in the sun. Look, they're up there in the 60, 55, but do people get respiratory viruses in the summer? No, rarely do you get sick in the summer. Americans in winter, 15, 25 on 1,000. And I remember I used to think 1,000 IU, oh my gosh, I don't want to take more than 1,000. I'd be toxic if I take more than 1,000. Well, we'll get into that in a minute. But look at this, 4,000 IUs. Oh, that's the upper limit by any standards, and you're going to barely be at 40. So I guess my point is, and I used to be a nurse, I used to work in the hospital. I used to always think that if you follow mainstream medicine thinking, you'll have the best of everything. Well, now, that's why I became a chiropractor, because I learned that, you have to go out there and get other education if you want to survive, So, anyway, my point is that do you want to be, the primates and humans in the sun have much higher levels, because we need to get the level high enough to spill over and have DNA expression. So what level do you need to be at? Well, now this is off that grassroots, but basically I'm going to skim over this real quick, but basically if you take 4,000 IUs, you can have everything from insufficient to way up here in the 140 range, taking 4,000 IUs. So how do you know where your levels are? You don't. You have to guess. Now, generally speaking, if we're taking, between 4,000 and 8,000, we're going to be somewhere on this line here. But we don't know. So you need to measure. So if you're at 20, generally if you take 5,000, you're going to be at 40. See how this chart works? If you're at 20 and you're going to take 10,000, you're going to be at 60. Why do you think I take 10,000? If you look at this chart, why do you think I'm taking 10,000? If you're at 30, 10,000 to get to 60. I want to be between 60 and 80 or 90 up here. I want to have full, if I need to rely on gene expression, I want to be able to have full gene expression, whether I'm fighting cancer, heart disease, diabetes, whatever. I want to have my genes be able to turn on when they need to turn on. So I'm taking. Okay. Can you take too much vitamin D? Well, everybody jumps on the internet and says, oh my God, if you take too much vitamin D, you're going to just fall into a pile of rubble. So how much is too much? Well, first, anytime I approach a problem with physiology, I say, well, how much do you get from the sun? Because usually we wouldn't have evolved, oh my gosh, get out of the sun, oh my God, the Neanderthals stayed out too long and they worked the fields too long, and oh my God, they fell over dead because they got too much sun. Well, from the sun, you get 10,000 to 20,000 from a good sun exposure. So now raise your hand high if you think that we're going to fall over dead by getting 10,000, 20,000. Okay, probably not. So why do we have this international unit? I've got another video that I put out there that explains the international unit, but it's real high. Look at this. Table 1 is what the RDA, so if you want to follow the medical profession, 400 international units if you're about a year old, 1 to 70, 600 international units. These guys are geniuses, National Academy of Medicine. If you're greater than 70, bump it up to 800 international units. You still might die of COVID-19, but at least you prevent rickets, because you're going to be down here 20 nanograms. Sorry if I get crazy, but I'm just having fun with it. So, okay, so 800 international units, 20 nanograms. Oh, wow, I prevented rickets. Woohoo! Up here, Endocrine Society, 400 to 1,000, 600 to 1,000, 1,500 to 2,000, 30 nanograms. If I want to get all the way up to, ooh, this is really good rickets. But what if I want to give above that? You have to take a higher dose if you want to get into the genetic expression. What's going to protect you against COVID-19? But 800 international units is 200 micrograms. Now, you need 1,000,000 micrograms to get to a gram. So when you jump from 20 to 250 micrograms, that is a very small amount, folks. So when I go from 800 international units to 10,000, that is a very small jump. Very, very small. So you're really not getting very much vitamin D, even at 10,000 to 20,000. So here, this is, again, grassroots health. I haven't seen any vitamin D toxicities less than 30,000 international units taken for, I mean, I'm talking months and months and months and years at a time. So I would not go above 30,000. Maybe if you have somebody that's, elderly or obese, you might go up to 30,000 or above for a while to get their genetic expression up. But generally, if you're at 10,000 to 20,000, you can't do it. I mean, you virtually can't do it 10 to 20,000. I've experimented with 20,000, and one day I fell over. No, I didn't fall over on 20,000. But I'm saying, now here's the one thing I noticed. I used to have, I never had asthma, except for around horses. I get deathly ill asthma around horses. I mean, literally, I'm going, I'm riding this horse, and I can't breathe at all. And people talk about asthma, and I probably had worse asthma than most people, on a horse. But I was dumb enough to stay on that horse because I really liked horseback riding. But when I started taking 10,000 IU, which I'd never taken that high dose because for my medical training, I thought, oh my God, I'm going to kill myself. And I noticed that my lungs started functioning a lot better, meaning I felt like I was breathing through a pipe. I couldn't exhale and get an expiratory wheeze. So I knew that at 10,000, I was doing something for my body that I had never, had that genetic expression before. So my point is, 10,000 to 20,000, you're not going to fall over dead. You're going to get a normal sun dose. Now, here's the thing. Do not take D2. I don't have time to get into it, but D2 is ergocalciferol. It's from mushrooms. Ergo, the ergot, the mushroom. And, it's really a dumb idea. Does it calcify bones? Yes. It's a drug, though. Do not take it. Only take the D3, cholecalciferol. And take it in, probably the oil base is best. Preferably take D3 D3 with K2. I don't have time to get into K2, but that kind of drives it into the cells and not into the calcium into blood vessels and all that kind of stuff where you don't want it. So you want to take K2 with it. So that's the main thing. K2 is a whole different, it's not vitamin K, it's a different thing, K2. And so vitamin D allows genetic expression to increase body function. How much do you need? You have to experiment. Someday they're going to have, you're going to walk up to a machine and it's going to tell you whether you have perfect genetic expression at that vitamin D level. And until we get there, it's all guesswork. And a lot of times, if any of you are clinicians out there, there's a little bit of guesswork. I hate to say it because everybody wants to say, hey, Dr. Paul, tell me exactly how. Well, it's a little bit of guesswork. Vitamin D deficiency related to many diseases, and you see why, because if you can turn on genetics in the heart, it's going to have beneficial for the heart, or the lung, or the brain. So wherever you turn on genetic expression, it's going to have adequate active vitamin D levels, maximum genetic expression. Yeah, if you have asthma and you were taking 800 international, and you'd say, well, it didn't help me. You might need to bump up to 20,000 IUs for maybe a week or two, and then bump down to 10,000 and see if it helps. And then if it doesn't help, then get mad at your mom for not taking enough vitamin D when she was pregnant with you. That's who you really get mad at. Okay, for optimal function, you need sun and supplements. It's not just from the sun. It's from some sun and supplements as well. So that pretty much concludes this craziness for a little bit. So if anybody has any questions, welcome. Yes, great. Yes, tell us. Oh, I was going to tell you at the end, I have this on YouTube. So if you go to I think my channel is One Health Chiropractic, and you can, the name of it is Vitamin D and COVID-19 Research with Asthma, and I'm surprised they didn't take me down, seriously. So you can go on there and find me on there, and I think they're going to send that out to you.
There'll be a link on Facebook.
A link. And if you didn't think this was totally boring, I've got another presentation on there that you can link in the description that goes into the history of vitamin E. The biggest mistake in nutritional history was isolating alpha tocopherol. And if you want to know why in the 1990s every cardiologist was recommending high-dose antioxidants and everybody take vitamin E, and then all of a sudden they came out and said, oh, antioxidants kill you and high-dose mortality and this and that. If you want to find out the real reason behind all of that, I suggest that video. And if you want to know why I'm the crazy one bringing that to you, I actually had the privilege of going through a library that was put together in the turn of the century and up into the 1960s. Took me 10 years to read this entire library on the real history of vitamins. And so that's why my expertise is in the not only vitamins today's perspective, but understanding the mistakes that they made back in the early days. So if you have any suggestions on other topics, we can pick those out. And if I don't know, I'll just make it up as I go. So thank you for joining us. And I guess does anybody have any questions? I don't see any questions coming through.
Here, I'll do that. So Suzanne had the question of what is the form of D3 that's easily assimilated, and how do you take it, I believe?
Well, there's theory and there's reality. I actually, my wife and I were taking two separate brands of vitamin D3, and I actually went to, I hate to admit this, but I went to Amazon, and if you get on Amazon and you kind of get an idea of what's working for people, and so I did that, and I got a brand off Amazon, and I was taking it, and that's when I noticed the difference. And my wife, she did all this research into this other brand, and it had K2 with it, and the one I was taking didn't have the K2 with it. I had to take it separately, and she ended up taking mine and getting better results on mine at the same dose than the one that got the better reviews. So sometimes there's a little bit of trial and error with that, but in general, I recommend the pearl-based, meaning it's in an oil, and when it's in an oil, it's better absorbed. Now, the one thing you really need to understand is if you've had your gallbladder out, you don't produce bile salts, which you need bile salts to bring in vitamin D. So that you may need to take it with bile salts to get that in. I think they did a research on pregnant ladies that had their gallbladder removed, and a lot of them would take vitamin D, and their vitamin D levels wouldn't come up. Because so if you're not producing enough bile, so that's one thing that you could have to do. If you're not taking, so I wouldn't take the tablet forms of it. If you're now some people could get away with taking the tablet forms, but then the oil forms out on the market are better. But actually, the best that according to the research, the best that are out there. They're real expensive, and I know Focus had some, but this is what you take if you are, say, really critically ill. Take the micellized, which what they do is they wrap the vitamin D around a micelle, like you. That's why you use soap in your laundry, is you want to emulsify the dirt and get it out of so it forms a micelle. So what they do is, in the best brands, they're really expensive, and I contact me. I have this really expensive brand, but I don't use it on myself because I don't need it. But if you need a really good brand, I've got I can send you in that direction. But it's a little more expensive than just what most people need. But it's emulsified to get that in. You spray it in your mouth, so it gets right into the epithelium. And because actually, when you bring in vitamin D, it has to go through your lymph system to get into your body. So you have to bring it in that way. So that's the way I say to best take it. But if you're the average person out there, I think the oil version would be the best. And I can send you the one I'm using if you want, for just the average person. But if you have a sick client out there, you need to go straight to the aerosol version, the spray, like 2 sprays or 400 IUs. That's what I would do to just make sure it's getting in your body. So maybe I over-answered that question, but I don't know.
I think it's good. It was for Suzanne. She says hi.
Oh, hi, Suzanne. I haven't seen you forever. We have to get together. I miss seeing you. So.
And what is the name of your practice, and where are you located?
Oh, I am One Health Chiropractic. I am at Memorial and Bryant, just between Oklahoma City and Edmond. It's right on the border. And now maybe we'll do a chiropractic talk.
Sure.
You know, if you guys are interested.
So if someone wanted to contact you for questions.
Oh, for questions.
And then email.
I have my cell phone. My cell phone is 608-445-9747. And you can text me or call me. That's the easiest way. Is text me, because for some reason I have U.S. Cellular and I don't get a lot of voice messages until like the next day. So text me is the best way to get a hold of me.
Say the number again.
608-445-9747. And my if you find that video online, it's in the description. All my office information is in the description of the video. And
I'm just putting it on the post.
Well, no, yeah. I was going to post it when we post this video, then we'll
oh, okay,
put your
okay.
information out there.
Okay,
too, so they can
great.
contact you.
Perfect.
Cool. All right. Any other questions?
Let me look for some on there.
Are there any on there?
I don't see any more questions, so.
Okay. Well, thank you so much for being with us.
Oh, thank you.
I learned a lot, and I'm sure everyone else did, and we look forward to having you again.
Oh,